It is a long-standing event in the community, and it's coming back next Thursday, April 28th. We're talking about the Minority Men's Health Fair, which offers free health screenings and education at Metro Health. And joining us now is the founder and director, Dr. Charles Motlin, and someone who has first-hand knowledge of how important this event is, Clinton Hickman. I want to talk about this year's health fair. First of all, gentlemen, thank you for stopping by this morning. Boy, first time in how many, 2 years?
It's
the
been,
pandemic kind of shut you down.
The pandemic shut us down.
Okay.
The last time we had the health fair was in 2019, but we're back.
Okay. Well, talk about this year's fair. How is it going to be different or more the same that we've been experiencing over these years?
It's essentially going to be more of the same.
Okay.
We actually have maybe some additional clinical service line offerings.
Okay.
We have some additional specialists that are on hand to provide health examinations, provide health information. We have about 450 volunteers ready to go and serve the men. We're going to be in 3 simultaneous locations at the Metro Health Medical Center. We're going to be at our main campus, West 25th Street. We have a site over at our Cleveland Heights campus, which is right across from the Home Depot, 10 Severance Circle. And also we're going to be at our Broadway location.
All this in one day on the 28th. So you're going to be moving around, kind of.
We're going to be moving around,
Yeah.
but we have volunteers dedicated to each location, 5 p.m.
yeah.
until 8:30 p.m. It's all free parking, free health examinations, health information.
You can't beat it.
You don't have to register. You can just walk in and just we're going to take care of you.
Talk about some of the services being offered, some of the screenings being offered.
So we call it the Minority Men's Health Fair, but it's actually open to all men, regardless of race or ethnicity. All are welcome. We're going to be providing comprehensive screenings from head to toe.
Head to toe.
When the men come in, we're going to encourage them to get their blood drawn. We're going to draw blood. We're going to be checking for prostate cancer, diabetes. We're going to be checking for vitamin D levels, hepatitis C, HIV, if the gentleman would want to get tested for HIV. We're going to be checking for cholesterol. Again, these are comprehensive examinations, and also we're going to encourage the men to visit as many clinical specialists for consultations, healthcare examinations as possible. And again, the reason we are specifically trying to engage men of color, because men of color have higher rates of these healthcare disparities, chronic disease states, higher rates of diabetes, hypertension, heart disease, prostate cancer.
We don't go to the doctor like we should.
We don't go to the doctor, and when we do, a lot of times it's in later stages that diseases are diagnosed.
Mr. Hickman, talk about your story, man. You actually attended one of these screenings, and it basically saved your life. Talk about that.
Yes, sir. I attended Minority Men's Health Fair, and as you said, if I hadn't, I wouldn't be here. And me and Dr. Motlin got together, and he became to be my doctor.
What did you have? What were you diagnosed with?
Prostate cancer.
Prostate cancer? Okay.
And I started off with 15.
You were at 15?
At 15.
Okay.
And with Dr. Motlin help and the Lord's help, it came all the way down. Now I'm at 0.01.
Wow. Wow. Now, for men, prostate cancer is something that, you can have it and not even know you have it, right? You got to get screened for that, don't you?
It's the most prevalent cancer in men. Twice the incidence and death rate in black men compared to white men. And a man doesn't have to have any signs or symptoms to have prostate cancer.
Right.
And the main message is that prostate cancer is potentially 100% curable if we can detect it in early stages.
Yes, yes.
And I'm glad we got to Mr. Hickman in time. His PSA, as he said, was 15. That's remarkably high.
Yeah. When you hear stories like this, doctor, how does that make you feel, man?
Well, I think it just it makes me feel grateful that we have a number of healthcare providers who have actually stepped up to serve the community. And really, it's our responsibility to educate the community and let the men know about the importance of early preventative health screenings, that you don't have to have signs or symptoms or pain.
And you've taken this thing on for 18 years you've been doing this.
We've been doing it since 2003.
Yeah.
And again, it's the success of the health fair is because of all the volunteers who have stepped up, the leadership of Metro Health, who have agreed to let us put this on.
It's excellent. You've been doing a wonderful job. You've saved, Mr. Hickman is just one person who you've helped over the years, and it's so very, very important for black men especially to get checked. Because like I said, we don't get checked. I don't know what it is. We don't like to go to the doctor.
A lot of it's fear.
Yeah, a lot of it's fear. A lot of it's fear. Well, just want to remind you, the Minority Men's Health Fair is going to be on Thursday, April 28th. from 5 until 8:30.
Exactly.
So it's in the evening. So, you know, it's not all day, it's in the evening. 3 locations of the Metro Health Clinic, Metro Health Hospital. The locations are right there on your screen. So you can stop by one of the 3 and just get checked out. That's the bottom line. Just get checked out.
Absolutely.
Yes, Dr. Martin, thank you for what
Thanks
you
for
do.
having us. Appreciate it.
Mr. Hickman, thank
Yes,
you.
sir.
Nice meeting you, my
pleasure.
friend.
Yes, sir.
All right.